There's so much to be proud of about the health and social care services that we provide in Derbyshire. We've got brilliant members of staff, we've got really engaged local communities and populations, and some really fantastic work, all of which is showing an improvement in how long our local people are living. Local organisations from across the NHS and social care have come together to form Joined Up Care Derbyshire. This is to ensure that we're in the best possible place to deliver the future that we need. We know that our population's health and well-being is determined by more than just the services that we provide. Our services don't always meet their needs. We need to work together to try and ensure that we can deliver high quality care to those people that really need it consistently across Derby and Derbyshire. As our population gets older, it's going to become increasingly difficult for us to really help people with what matters to them and to address their social needs and their complex care needs. We want to make sure we use our services and resources in the best possible way, and we want to do that by making sure that we're not caring for patients in a way that they don't need or in a place that they don't want. It's really important that we look at examples where we've reduced the length of time people are staying in hospital as examples where we've been really successful in doing that. I know we've been working really hard to get our own houses in order, but some tough decisions are going to have to be made. We're going to have to look at a radical rethink of how we deliver services and how those services are commissioned. Doing nothing is not an option.
We need to make sure that patients are cared for in the right place, whether that's in hospital, and that includes the big acute trusts, or in a patient's own home. It's about making the best use of our services. And I think the longer patients stay in hospital inappropriately, then the more likely they are to develop complications.
Over the last few years, we have invested in our local communities to help people support each other to stay well.
Currently we have over 350 members across Derbyshire. The benefits of Time Swap are that it absolutely reduces loneliness. Lots and lots of friendships have been made through the scheme. It gets things done for free for people that are members, and it definitely does keep people well.
I am a member of Time Swap, and it's the best thing since sliced bread. I know you laugh at that, but it is. I can't tell you the change it's made for me. Absolutely. Changed my life completely.
In my opinion, I don't know where I would be without my local area coordinator especially. If I need her, she's there in a flash. And you don't always get that from people, you know. It's these guys, I just feel that they're special, and I feel that they are really, really making such a difference in people's lives.
There needs to be more investment in mental health services for people of all ages to help improve mental health and well-being. We need to ensure that child and adolescent mental health services are suitably resourced to meet the needs of everyone in the city and county.
There are high levels of demand for child and adolescent mental health services. There are already great services in place to help support the positive mental health and well-being of children and young people, but more needs to be done.
We know that a healthy mum and family is the first step in giving any baby a healthy and good start in life. They should feel confident, capable and well supported. We want high quality, safe, personalised services that promote pregnancy and childbirth as an event of social and emotional significance where women and their families feel respected, well cared for, with dignity and compassion.
Services could be run more efficiently across Derby and Derbyshire. Historically, a lot of money has been spent on buildings that don't meet the needs of our communities today. We know we could provide more appropriate and effective services in different ways, and together we want to provide care closer to home.
We know we need to do things differently. In order to provide high quality, safe and sustainable services, we will need some staff to work in different ways, in different teams, in new roles. We need to continue to invest in our highly skilled and committed staff to ensure services are resourced and responsive.
We all want the best health and social care for the people of Derbyshire. We want people to feel empowered to look after themselves. We want local communities to support those that are more vulnerable amongst them. And we want locally delivered services to support those individuals that are really in need of help. We know that what really matters to our local population is being close to where they live, close to their community and close to their loved ones. We can work together to transform those services to make them more efficient and more robust so that we can really do what the people that we try and serve want us to do. We should look after and focus on people based in their community and what their local needs are, not the needs of the organisation, the buildings and the structures. We need to focus on what really matters to that individual and how we can support them in that. Achieving this change within the funding that's available is not going to be an easy task. I know we can tackle this challenge. If we work together, we listen to each other and we all come up with the solutions, nothing is impossible.